Today I am speaking to Mr Attar, who I'd like to introduce. Could you tell us what it is that you do, Mr Attar?
Hi, Helen. Thanks for having me on today. I'm an orthopedic surgeon specializing in joint replacement surgery, joint reconstruction surgery, and regenerative therapy procedures. And I've got experience in working as an orthopedic consultant over the last 12 to 15 years.
Perfect, fantastic. So I met Mr Attar when I had some treatment on my knee. Would you like to tell everyone what it is that you did?
Right, okay. When Helen initially came to see me, she was struggling with quite a lot of pain in the front of the knee. And we did the initial investigations. And at the time, she'd been through a lot of different modes of therapies. She'd tried various different treatment options, and nothing really had worked for her. So when we saw her and we initially examined her and did the investigations, we found that she had a little bit of cartilage damage just to the undersurface of her kneecap, which we call the patella. And she was having quite a lot of pain on activities and movement that were stressing that joint and making it more problematic for her routine day-to-day activities as well as sporting activities. Now, because she had reached the end of a tether really with regards to treatments and trying out different options, we tried to go around the route of regenerative therapy. So I introduced the concept of PRP for her, which is the platelet rich plasma, and we discussed the mechanisms of treatment. And because it was very minimally invasive and it's really made from your own blood, where we concentrate the healing factors and inject it back in, the side effects are minimal. And she was quite happy to try this out. So we got an initial session booked in, gave her the injections, and since then, we've sort of moved on with her actually having quite a lot of improvement in her knee function and pain levels.
That's totally right. So I went to Mr Attar and I hadn't had any trauma to the knee or anything like that. It had been a slow progression into feeling pain, and it moved into pain throughout the day. And I teach group exercise classes and yoga, so it was causing me some problems with that. And unfortunately, before I met Mr Attar, I was told a lot of the time that I'd have to stop doing all these things that made me so happy. So this wasn't a route really I wanted to consider stopping, and this is where I found the PRP. Basically, it's that simple, and I really like to get over to everyone that if it can work for me, it can work for other people as well. So I think it's really positive step forwards. Why do you think it worked so well for me? Does it work for everyone?
I think you've got to be really careful with regards to using PRP as a treatment option. And it works really well in certain conditions. And there are some prerequisites with regards to cartilage damage. In your case, was early and mild. So those are the areas where it really works very well in. And you can extend that up to almost moderate amount of degeneration or cartilage damage. But you've got to be very careful that we cannot use it pretty much for everyone. So people who have or are suffering with quite severe osteoarthritis and pain because of that will not be effective because there's not much cartilage there to help heal and regenerate. So the criteria to use it in conditions of cartilage damage and osteoarthritis are quite minimal. And as long as we have the right people who fit the category, it'll be very suitable for and they'll benefit a lot from it. Same way, we also use it for tendonitis, inflammation in the tendons, and some muscle tears routinely in sports people. And again, very clear-cut criteria and indications. And again, if we use the right people with the right areas that we're treating, then they work very well.
Yeah, that's brilliant. I think when you said using the right people, it's finding the right people for you, isn't it? So finding the right levels of support, because I don't remember at any point you telling me to stop doing the things that kept me so happy.
No, absolutely. I think the most important thing is because PRP is a biological regenerative therapy, and because it's very minimally invasive, the procedure itself is just a simple injection that's done in clinic. It takes about half an hour to do. And after that, we all always say is take it easy and rest out the joint for a couple of days before you slowly start getting back to your routine. And some conditions require 1 injection, some require 3 injections. But all in all, this has to go hand in hand with your routine therapies that we normally use. So physical therapy, yoga therapy for stretching exercises and joints. So we work together to try and make sure we're treating anyone with both the medical side of things as well as the adjuvant physical therapy or yoga exercises as well.
That's great. And I am obviously really into yoga, and I've used it to successfully build back up from the injury and strengthen everything around it. So it's worked perfectly for me, and definitely.
Yeah, absolutely. I think that was a sort of, yeah, that was the right option, because once you've had the medical treatment, you obviously got to supplement it with your yoga, with your stretches exercises, with your physical therapy, and they both go hand in hand really to try and give the best outcome possible.
I agree, and treating the body as a whole as well, isn't it? Because you could have tightness throughout, and then having to work through that as well as the area of the
Yeah, absolutely. For example, if you've got a problem with your knee or ankle, you invariably end up having problems with your walking, with your stance, with your gait, and hence it affects your other joints such as hip and your back. So you need to have sort of almost an integrated approach to try and look and solve everything that's an issue. So rather than just treating this joint or the problem at hand, you've got to treat the whole patient, and you've got to treat the whole person and any other subsequent problems that they have. And that's where the physical therapy, the yoga stretches all come in really handy, because they go in to supplement the treatment that we are actually giving in.
Of course, and then it's all about understanding the mindset of injury as well, isn't it? So, do you often hear this story where people go and they try lots of different physiotherapists and osteo and chiro, and they don't really get anywhere? Do you hear that story a lot?
Yeah, we do. We do get a lot of people coming down that route, and they almost reach us after they've tried a few different options. But I think the bottom line with that really is, like you said, having the right mindset, to know exactly what you're dealing with, what you're treating, and trying to use a whole sort of integrated approach in not just providing the regenerative physical medical therapy side of things, but also the supportive mental side of things with regards to any other supplemental therapy that is there.
I agree, and anyone who is eligible for this to work well for them can achieve a good result. Is that true, or?
Yeah, absolutely. I think, like we said, if as long as we're sort of quite strict about the criteria and who this is suitable for, that's just one element of the treatment option, because we get that element sorted. But obviously, with that, they have to have your supplemental physical therapy, muscle strengthening exercises, stretching exercises with yoga, and obviously the right mental attitude. And then they have to be able to build a regimen with regards to getting back to their sports, their activities, what they like doing. And all these sort of go hand in hand, and they're all sort of integrated together. So rather than just having it as a treatment, we're more inclined to sort of tell people that it's a whole sort of therapy protocol that they're actually buying into and they need to follow. And as long as they're strict to that and adhere to that, then there's no reason why they shouldn't get good benefit and good outcomes like you yourself did.
Of course, yeah. So at the moment, that was step one for me. Although after a lot of different areas that I looked into, and obviously yoga was step two. And I also have found that what has really helped is also finding again the right support. So I have been looking into traditional medicine as well, and that allows the release of some tightness, that builds up every day as well.
Sure.
So it seems to work perfectly as a complete package. Fantastic. Well, thank you so much. That's been really helpful. And I think the main message that I'd personally like to get out is that if there's something that people want to achieve and they're maybe told by others that they can't, there might be other avenues that they can explore and have a look into.
Absolutely, I totally agree with that. And I think regenerative therapy and medicine here is more and more upcoming and is here to stay. And there's a lot more people we're utilizing it in, and we're having very favorable outcomes. And this is not just here with us. This is sort of figures across the world. So I think years to come, I think that'll be one thing that'll really build, develop, and expand on, because it's minimally invasive, and most of it is done as an outpatient setting in clinic. And obviously, alongside that, if we add in our physical therapy, rehab, yoga, stretching exercises, any other integrated medical approach, it's a whole package, like I said earlier on, to just give the best outcome possible with the least amount of involvement with any surgical intervention.
I think that's great to know, and I think it's a great message to give out as well. So thank you so much for your help today.
No problem, Joel. Thanks, and thanks for having me.